the difference between heart attack and heart failure?
A heart attack is when blood vessel blocks, and that blood vessel is supposed to supply blood to the heart muscle, and then suddenly there's a blockage of blood flow, and then the heart muscle starts to die off. Heart failure is more of a syndrome where the heart is inadequate. It doesn't pump enough to supply the body, and it cannot keep up with the body, it backflows. So heart failure is when the pump fails, usually in terms of like long-term failure. Heart attack is like a sudden abnormal heart issue that happens right away.
What does valve means and how you do replacement with that opening?
Oh, that's a really good question. Your heart has valves, and the valves separate different chambers of your heart because your heart's a pump and there's 4 chambers and there's 4 valves. And so when these valves degenerate, they need to be replaced. Traditionally, we would replace them by cutting open the patient's chest, stopping the heart, taking the heart, sewing it out, and putting a new valve in. So nowadays, for a lot of the valves, actually, they can be replaced minimally invasive and then having them go home the next day.
Hey guys, and today's episode is going to be with Hafeez, Interventional Cardiologist. Adam, is it scary to do surgery when people are still awake?
Yeah, absolutely. I mean, most of our procedures that we do, people are conscious. And so we're treating their heart attack, we're inside their heart, and people are awake. They're watching the screen, they're hearing us talk, and they oftentimes talk to us, and we get to hear what they have to say. And over time, I've kind of gotten to know, like based off of what people are saying, what's going to happen next.
Do you guys use different technology now, or any new machines you guys use now?
Yeah, absolutely. I think in like the modern world, like we talk about precision PCI, which means being precise in the way you approach people's hearts and put stents in. And all of this is based off of imaging. So we try to quantify and qualify. We use different types of tools to use ultrasound waves to image the heart vessels, understand what type of problems are happening, why they're happening, what type of blockages people have. And it's all based off of different technologies. And that's the fun part of, interventional cardiology is that we love our toys. We love our tools, we love our toys, we love our technology. And anyone who can give us a new toy, we're ready to play with it.
Beautiful. What caused heart attack?
So heart attacks are caused by blockages in the blood vessels, which are called arteries, that supply blood to the heart muscle. So the heart muscle has on top of it blood vessels that give blood to the muscle to support the muscle. And if any of those arteries become blocked, whether it's because of a plaque, whether it's because of a clot, whether the artery just spasming itself, that causes the blood flow to be interrupted, and then the heart muscle dies and people feel pain, and they can get so severe that people can die on the spot.
So what's the difference between heart surgeon and you?
What you guys do?
Yeah, that's a good question. I think a lot of people ask us about.
Because you talking me personally, like I thought heart surgeon, that's it. That's the highest you can get.
Yeah.
So what's the difference?
Yeah, so I think there's like two main ways to look at the difference between heart surgeons and interventional cardiologists. One is the training. Heart surgeons go through surgical training. They're trained to be surgeons, and surgeons are primarily approaching things by like cutting and doing surgery in the operating room. Cardiologists are trained through internal medicine. So we're actually trained to be like clinical doctors, which means that we all went through internal medicine. We learned about we practiced the kidneys and the endocrine system and rheumatology and hematology. And then we specialized in the heart, and then we specialized in procedures involving the heart. So we're like more of like a comprehensive long-term physician. Like we treat people in the heart attack, but I'll see you for the rest of your life in my clinic because I can take care of that. Mm-hmm. And then we don't cut people with like knives or scalpels and open up people's chest. All the procedures that we do, including heart attacks, we do minimally invasive. So we use wires and tools and toys and catheters, and we go into people's hearts and we put stents in and put valves in, but it's all minimally invasive. That's how we can do it when you're awake.
Wow.
This is like that makes it any better. Wait, so this guy is fully awake right now?
Yeah, so like
he's talking to you, no anesthesia, no nothing.
Correct. I mean, I'll give them, there's no anesthesiologist, So it's not like they have a breathing tube. It's not like someone's putting them to sleep with medications. I just give them pain medications and I give them anxiety medications. Medications
That is
that
giving me anxiety right now.
medications that deal with anxiety.
I would like it.
It looks awesome, man. It looks fresh. My patients will like it too.
Die another day. Tell them that.
But I think it is challenging to do a procedure when someone's awake. You have to be precise. You have to be different. But it makes it fun. It makes it hard. And oftentimes patients are not cooperative.
2 questions. What's the difference between the anesthesiology and what they do and how that affects the patient? Obviously, like we know they go to sleep, etc., but like the science behind it versus the drugs that you give, the medication. And the second question is how much of your role, or how much of it as you being a conversationalist? Because if this person is awake and you're dealing with their heart, I'm sure they're going to be asking you a lot of questions like, am I dying, or is this happening, or why do I feel this? Like, how much of your conversation is involved in the actual treatment process? Answer whichever one you want.
Yeah, that's an awesome question. I kind of have to answer the second one.
Bismillah.
It's a really good question. Yeah. Is like, I talk through my procedures. So when the patient's on the table, I'm like, hey, you're having a heart attack. I think that's what's going on. I'm going to get access. You're going to feel a sting and a burn. And then when I take my initial pictures, if I see there's a blockage, I'll tell them that, look, I see the artery. It's blocked. You're having a heart attack. I'm going to go ahead and start fixing it. You might feel some pain. And unfortunately, some patients, things don't go to plan. Sometimes you balloon the artery and the artery shuts down and they start getting worse. And I sometimes tell them that, like, hey, the artery's shut down. You're going to have a lot of pain and your heart's trying to stop. Just like, let me just fix you. Let me just work with you because you're going to die otherwise. And I've said that to patients. Like, hey, listen, I know you're in a lot of pain, but you're having a heart attack and you just got to let me fix you. And it's frustrating for me because like patients are trying to move around. Sometimes when the heart stops, they start to like move around and they start throwing up. And I have to like hold them down and just, I'm in their heart and I'm just moving millimeters.
How many other people with you in the room?
So it'll be 3 a.m. and it's me, my scrub tech, a circulating nurse, like someone in the control room, and that's it. And it's 3 a.m. And this is the sickest person in the hospital because they're having a heart attack, so their mortality is the highest. So it's not like if someone goes to the surgical room, they have an anesthesiologist. Correct. They're stable. They're not.
It's a planned procedure.
It's elected. There's 7 people there. It's happening, and there's surgeries that happen obviously emergent at night, but it's like a team thing. But for us, it could be anytime I get a call that someone's having a heart attack and I have 30 minutes to get to the hospital. And I have, from the time the patient hits the door, I have 90 minutes to open up his artery. If I don't open up his artery in 90 minutes, I have to explain why.
Right.
That's the time. And the hospital looks at how fast can I do it
to treat that patient.
So it's crazy.
Is there a medical reason behind the time, or is there like a turnaround versus how many ill people we've got currently and how many doctors?
No, there's a medical reason that if people having heart attacks from the minute they hit the door of the hospital, if they have their artery opened up within 90 minutes, they have better outcomes in terms of like cardiovascular death and mortality and things like that. Their heart
got oxygen quicker.
Exactly, because your time is muscle. So for every minute their heart's being damaged, you're losing heart muscle. So we literally like are speeding through the procedure. We're going on, throwing on our grounds, we're running in, we're going that, and we're doing things fast just to
save that muscle,
to meet that marker so we can open up the artery as fast as possible. So it's really different than any types of medicine because very few, doctors will have to wake up at 3 a.m., speed to a hospital
and be ready
to take the sickest patient in the hospital having a heart attack and save their life, and doing it really, really fast and doing it precisely with all the tools and things like that.
I got so many questions, crazy. Man. Like,
it's
okay,
we're like junkies for like.
Okay, thrills, so what is the mortality rate in these procedures versus, or let's say, what is the success rate, right? Because this is someone who's already on their way out. You're like the last guy before the angel of death. He's gonna see,
Well, so like if people are having heart attacks and they're able to get treatment, you can really change their mortality. That's why it's very gratifying. But if someone's having a heart attack and they don't get treated, their mortality goes to 40-50%.
Right.
Because they can die on the spot, which is really high mortality. 40-50% is like, you might just...
Yo, it's a 50-50 now, buddy.
Yeah. But if you can get treatment and you do it quickly and you do it properly, you can really save someone's life because you make their mortality, you just bring their mortality down and you make them better and you give them, and people will get better where they're dying one moment. And sometimes we shock them. Like I have people awake, I'll shock them on the table with the pads and I open up their artery and the next thing they say like, hey, I feel better, I want to go home. And I'm like, you were literally dying. I shocked you.
And now you feel want to go home.
But that's because their mortality is high, but you bring it down really fast. Yeah. And that's why, like, we do interventional cardiology is you right away, you instantly change somebody.
Wow. Is your heart changing is your heart rate changing while you're hearing this? Like just the anxiety? Okay, so now I'm thinking, sorry to cut you off, Hattouf, but the patient.
Yeah.
Okay, you're working on his heart.
Yeah.
You're telling him these things like, yo, brother, you're about to die any minute now. You need to stop moving. I'm sure his heart's gonna start beating faster. Like how do you?
Because we're monitoring people's EKG. So like the whole procedure, my eyes are on the screen, which is looking at X-rays on his heart. So I'm manipulating my equipment here. My eyes are on the screen, but then I'm looking at the blood pressure. I'm looking at the pressure monitor. I'm looking at the EKG. I'm looking at my staff. So it's like you're in a cockpit and like you're flying and you're monitoring all of these things. And as a main operator, my job is the whole procedure from everyone, my staff safety. I'm using radiation. So people get radiated. I have to be conscious of my staff. So there's all of these nuances, but like when I'm there, my eyes are dancing. I'm looking at this, looking there. I'm hearing what the patient goes, I'm like, what happened? Did I balloon too much? Did something happen? Because patients will tell you.
Okay.
If he feels pain, that means something is wrong. And I teach my staff all the time. I'm like, hey, he's moaning. Why is he moaning? Oh, he's just, I'm like, no. He's moaning. Tell me why. And he's like, oh, I'm having chest pain. I look at the artery, it's torn. Or the arteries stop flow. So like it's amazing because I can correlate with people's breathing patterns and what's happening on the screen and their blood pressure. So you're just suddenly in control of this whole thing. And the patients are awake, So it's thrilling, it's high risk, it's fun, but it takes a toll on
That's fun?
It takes a toll. Like you're
honestly, he's saying this, and I'm thinking Call of Duty. Like I'm not to compare, but that's literally what you're doing in a game. Because check the map, check the pings, check this.
So what does the valve replacement mean, and how you do it with that open?
Yeah, that's an awesome question. So,
and how long do you usually take you?
Yeah, so like that's a really good question because that's something that's like one of the new technologies. So your heart has valves. There's 4 valves. So your blood goes from chamber to chamber through valves. But these valves are literally like valves in a car. They separate 2 fluid-filled chambers, and the valves can get rusty. We call it calcified. They can leak. They can become damaged. They can stop working for degenerative issues. And the reality is, for a lot of people living your whole life, as you get 80, 90, these valves will get degenerative. And before, when you're older, you can't fix the valves because you can't cut open a 90-year-old person's chest, open up their chest, fix the valve, and sew them back together. They're not going to survive, right? But nowadays, we have minimally invasive procedures through interventional cardiologists and structural cardiologists where we work with a team, and we basically, through the groin artery, we have valves that are like we call it crimped. They're like folded onto like rods called catheters. We deliver it and we deploy the valve from within the heart while the heart's beating. So literally, like we do this procedure called the TAV, our transcatheter aortic valve replacement, and we take a valve and we put it through the old valve while the heart's beating.
Man,
and we just deploy it, and we do it on people who are 90 plus years old. And as a fact, when I was in fellowship, we did a TAV on a 99-year-old patient. And just 2 weeks ago, I had a 98-year-old lady who had a heart attack, and I took her to the cath lab, and I put a stent in her heart while she's 98 years old. That patient at 98, she can't get open heart surgery. She's going to die.
She won't recover, yeah.
But I was able to open up her artery during a heart attack, even though she's 98 years old. I mean, it was hard. It was hard for me to do it because she's 98. She's frail. She's fragile. She's kind of confused. But like, she was walking and talking, and she's having a heart attack. Either she dies because of it, and she gets worse, or I do something about it. So I took her and I did it, and it was risky. And some people wouldn't, but I did it. And alhamdulillah, she's alive. And she told me after, she's like, I feel better. And she went home and she lives her life.
Man,
so cool.
Now, how you usually, and I'm gonna put it that way, What's the craziest surgery you did and you have difficult time like to fix it? Has that happened to you? Or?
Yeah. I mean, unfortunately, like most of the craziest surgeries we do are ones that we have complications, ones that we make mistakes, and we basically like kill people, right? And that's like the toughest part, and it's emotionally taxing and it's like mentally taxing because you could do everything right
And they still
and
won't happen.
still you can make a complication, and that's the toughest, I think, surgeries or any procedure, even if it's the simplest one, but you cause a complication. Like it could be the simplest thing, but you just cause a complication.
Now, obviously, it's never intentional, but
never
you're working
intentional,
under immense pressure.
But it just happens.
It happens.
Yeah, I had this one young guy, and he had a heart attack, so I fixed him. And then he had another blockage in the other artery, so I brought him back the next day to fix the artery. I thought it was going to be. It was Friday night. I thought I would just go put the stent in. But during the procedure, some of my equipment didn't fit properly, and it went and it tore the artery. The artery has layers. It tore it, like it just split it. And suddenly he lost blood flow in this big artery. And he's like this 40-year-old guy, like has kids. His blood pressure fell. I lost my wire, and I couldn't wire back in. And my partner helped me, but then his heart started fibrillating. It started going into a deadly heart rhythm. And so then I had to shock him 15 times. So I'm sitting there like, oh my God, what did I do? I totally ruined this artery, and his heart's fibrillating, and I shock him once, twice, 15 times. I keep shocking him. I'm stenting the artery. He's still like, his heart's still beating irregularly. He's unresponsive. Then I call the anesthesiologist to intubate him, protect his airway. His heart won't stop. So I had to put a heart pump through his groin to pump for his heart. And I almost thought that I completely killed him. And he was feeling good because I fixed him the day before. Amazing.
SubhanAllah.
So it's just like, those are the toughest cases because...
Did he survive?
He survived. And he did well, and he saw me in clinic, and he's walking. He saw me multiple times. He's doing fine now. But it was just really tough because to take someone who's normal and then to hurt them, that's the toughest part.
Again, without intent. Oh. But so now I was going to ask. So that's a beautiful layup to a question I've been having in my mind, right? Obviously, we're Muslims, right?
Yeah.
And not just Muslims, like even a lot of my Christian friends, or like Jews, or like even people who are just believing in a higher power. We believe that life and death is khalas, it's written.
Exactly.
Okay. Kullu nafsin dha'iqatul maut. We know that. It's just the how and the when and the etc. and the etc. But at the same time, there's also this side where it says, if you want to see the miracle of Jesus, just go to an ER, right? Because Isa bin Maryam alayhi salam, one of his miracles is that وَأَحْيِي الْمَوْتَى بِإِذْنِ اللَّهِ. Through Allah's permission, I bring a person who's dead back to life.
Exactly.
And that's exactly what you guys are doing, right? His heart, he's dying, by all means. Sometimes he's gone under. You bring him back in, okay? So how much, obviously, again, with Allah above everything, like how much of it do you, when you're working, do you put down to God in a process to deal with? Because you're telling me the story is traumatic.
Yeah.
That someone came in. So how much of it that makes it comfortable that, I did my best, it was up to Allah, or how much of it goes into, no, you know what, we could have done more because Allah gave me the technology, the knowledge, the schooling.
He was talking about it earlier. So about he told me you're amazing, like how you caught. I told him, look, all that, it's a gift from God. I don't know when he gonna take it.
Exactly.
Yeah.
So
no, 100%. I mean, I think it's like humbling because you could do everything right and still end up with the wrong result because and we learned that we're just millimeters away from causing a problem because we work within millimeters. Our stents are millimeters. Our wire is 0.014 of an inch. That's how small the wires are. So 0.014 of an inch. So really, really micro technology. So you're literally like little movements away from potentially hurting someone.
Yeah.
And you just realize that you don't really know inside what maneuver you're gonna do and what it's gonna cause. right? You get lucky and you kind of arbitrate these like probabilities. Well, if I put my wire there to protect it, then I put my other wire here and I balloon here with this size, I think I'll be okay.
And by the way, you're calculating this at what speeds of the situation before you.
You're doing this like at 3 a.m. at night where you're tired, you're sleeping.
You gotta be quick.
And you're just arbitrating these like probabilities. And as a Muslim, you're like, man, like if Allah wants this to happen,
it's gonna happen, baby.
Like, I'll get through.
I'm gonna bring my argy down.
But if not, then all I can do is just do the best I can.
Yeah.
And try to do like the best for the patient that I can humanly do, knowing that I'm not perfect. I had a case recently, and I remember it was a very, very tough case where the lady was actively dying and nobody was doing something for her. So I took her last minute. And I took her on like a whim. Like I'm like, okay, someone said, look, she's gonna die. She's prior to this otherwise healthy. Can you do something? I said, well, she might die during the procedure. I told her she might die on my table, but I'll offer it. And she had the worst thing where her whole entire artery was blocked. But I called to like one of the referring hospitals, like the main hospital, and I told him this is what's going on. He's like, you got to put in a heart pump. She's in shock, whatever. But I asked him on the phone, I'm like, should I wire it and try to fix it? Because I'm like, this might be too much for me. He's like, you got no other choice. Like, he's like, it's cold, it's shock, just try to fix it. So I did fix, I fixed something, and she lived, and she's alive. Currently, she's alive. She's critical. But I did something that I've never really fixed before.
And in this instance,
but I did it on the spot, knowing that I might not know exactly how to do it. I don't have a teacher with me. Yeah. It's Friday night at 9 p.m. No one's here. And I just have to do it. There's no other choice. And I just did it. And it worked out okay.
You know what, Doc? You say this. I got a younger brother, Ammar, 1 year younger than me. Ammar had a heart attack when he was young, I think 6 months or something. It was a blocked artery or something. Anyway, my mom tells the story. She's like, I put him in the cradle.
Yeah.
I went out. Then something like just told me, why is your kid quiet? Too quiet. She said, I went into the room. His face is blue.
Oh my God. Wow.
So they rushed him to the hospital. This is back home. The doctor pronounced him dead. Dead. Subhanallah, just like you're saying, like sometimes you're like, khalas, it's done, Yeah. Another doctor walking by, his shift is finished. He hears my mom crying, Ya Allah, save my kid, whatever, nidhr, like mannat, all this. Yeah. So he comes back, he's like, let me just read for the kid. He passed away, let me read a Fatiha, Subhanallah, something said to him, just check this kid. He gets real close to him, he can feel like still like, I don't know whether he felt a faint pulse or air or something. His first reaction, my mom tells it, he turned around and he slapped the nurse or the doctor or whoever told him that this kid is dead. He said, right now, we've got to start moving. We can't operate on him, but they start doing the chest compressions and everything. He tells my mom, he says, as soon as he reaches, I think it was 5 or 6 years old, you need to operate. Because right now, again, like you said, that's a very important point. Yeah. People will say, oh, but why don't we always just use one kind of thing, like what you're saying? He's too young, you can't do open heart surgery.
Exactly.
He won't survive it, just like an elderly person.
Exactly.
What's the difference between heart attack and heart failure?
Yeah, that's a good question. So like heart attack is commonly what I said. It's when the artery blocks and you have pain and your heart's not getting blood to its muscle. So the heart's hurting and you have a high chance of like dying right away because the heart could stop. Basically, that's what would happen. Heart failure is like a whole syndrome where people's heart doesn't pump enough to supply the whole body, basically. Right. And so your heart's inadequate. It can't take care. And either it's because the heart's too stiff and it doesn't relax, or it doesn't have the pumping power. And the reason is why. It could be because of a heart attack or something else.
Or the leaks you were talking about
earlier. Or the leak in the valve, or the heart muscle, it has a genetic problem or something like that. But the heart failure is your heart cannot keep up with your body, basically. Right. So it's more of a syndrome. When people have heart attacks, they usually have heart failure, at least at that moment for sure, and they end up with heart failure oftentimes. But it's more of like a global syndrome.
How do you know when the person needs stents? Is it they call it stents? Stents.
Yeah.
Versus someone need just medical only.
Yeah, and that's a great question. So, like, how do you know when someone needs like a stent to be put in their heart or just medicines? So basically, that's like a big, like ongoing. We learn every year about new like perspectives on
Advancements,
this.
yeah.
Previously, people used to get stents all the time, and the problem was that when you get a stent, it stays with you for the rest of your life. So if you're young and you get a stent, that's
For
going
the
to be
rest of
with
your
you
life.
for the rest of your life. So,
Wow.
and then remember, stents themselves can get blocked. It's like a pipe. You put like a stent in a pipe. Well, the stent can get blocked too.
True.
So actually, like the common feeling is that stents are like bad. Like, why do you want to leave metal behind in someone's body? And so medications are getting better. And so if you can manage someone medically, that's preferred. And so typically, when people are having active heart attacks, usually they get stents. But if they're not having active heart attacks, the first thing that we should do is lifestyle, diet, and all those things. And if they need more than medications, and if those don't work and the blockage is there and they have symptoms, then you need stents.
Worst diets. I know like Desi's, the ghee and everything.
Yeah.
We've got it up there like the Salon.
Yeah.
But like also McDonald's and everything is like I think higher.
Yeah, I mean
You
the
know.
Southern diet, like the Southern diets, like
Who-
that too.
What diets like do you, or what kind of lifestyles do you see mostly at the operating table? Like I'm sure there's a consistency. Like I'm getting people who are not active, people
Yeah.
who eat
So
too much.
a lot of smokers, a lot of like tobacco smokers will be there. Especially cigarette smoking is high. Diabetics are really high. Diabetics will always develop heart disease.
How bad is this?
It's not as bad as like smoking or like diabetes, but like there is risk using vapes, mostly
Associated,
for
yeah.
lung damage.
And there's still not enough studies on it, but yeah.
Yeah, but like for like lung issues, but for people coming to heart attacks is going to be your tobacco users, diabetics, people with high blood pressure, high cholesterol, generally obese patients, but not necessarily the type of obesity that you'd think like really obese, but people with like central
got fat.
obesity, they have some family history, high cholesterol.
We're fluffy.
Yeah, like they have these like bigger waists and stuff like that.
Yeah.
They're just common to have the heart blockages.
And how much of it is genetics?
There's a good amount of it that's genetics, more than like I think we appreciate. Like Southeast Asians, like Indians,
Yeah.
and them, we have smaller arteries, so we have more predilection for disease. And so I think there is like a genetic predisposition. Also, like the risk factors, like high cholesterol. Well, some people just genetically can't metabolize cholesterol the same way, for
Right.
example, and so they end up with like more blockages and things like that. And so a lot of the risk factors are related to genetics. So about like 20 to 30%, I believe, is actually genetically mediated.
And then the rest is
And
lifestyle.
the rest is lifestyle. So the worst is like you have a little bit of genetic issues, but then you're smoking and diabetes.
Not healthy.
And these are the people, they have accelerated disease. Where they're
Right.
40 years old, they're having heart attacks. I know I work in the Dearborn Hospital here, and we see a lot of people like, 40, 50-year-olds that are not like obese or something, but they're having heart attacks.
Because
A lot of
lifestyle
it's a
choices.
little genetics, but really bad lifestyle on top, and it just sets them.
Is it there different in how you approach younger versus older men
Patients.
in the procedure?
Yeah, I mean, I think younger people.
Because you just talked about like he's 40 years old.
Yeah, I mean, younger people were sometimes more aggressive about saving them. Like if they're having a heart attack, and even if the heart's stopping and they're getting chest compressions, we'll be more likely to like take them because they're so young
Yeah, of course.
and they have a high chance of survival, as opposed to someone who's 80 years old and has multiple problems. Like even if you do something, they still will have a bad outcome.
Percentage wise, what's the age that you see mostly? Like how many of your patients, sorry to cut you off, but how many of them are young, your patients, and how many of them are like above 35?
Yeah, so I mean, I think like for like in terms of heart attacks and like heart patients, actually I see a good split where I do see a good amount of our patients are between 40 and 60 years old, and they're on the younger side, and about like 50% of the patients that are having heart attacks are in that range. And then you have obviously like the 60 and older, and they always have problems.
Right.
And that's like the bulk of it, but there's a surprising amount of 40 to 60-year-old patients that have heart attacks. I mean, the youngest heart attack I did in fellowship was like a 16 or like a 13 or 16-year-old kid who was running a marathon out in Tallahassee, and he had chest pain and he collapsed or something, and they flew him to our university. And I remember that they were surprised. They didn't even think he's having a heart attack. And then they called us, and we're the adult side, because the pediatric side wasn't gonna. They didn't even know how
to deal with
fix
it because it's not common.
It's not common.
Yeah.
So they called us, and we literally, like, it was a big hospital. We walked across the road with our equipment
To goals.
across the road to the pediatric hospital, and we scrubbed in and we fixed him. And I remember I wired his artery and his stented him. It was like a runner, an athletic individual who had a heart attack. So it happens.
What does most people get wrong about heart disease?
I think a lot of people think that like, number one, heart disease has to run in families. And if it doesn't run in family, I'm okay. You know what I mean?
Okay.
Not necessarily true, right? Like, in a person's individual factors, risk factors make a big difference. And I think people forget how important it is to be, like, physically fit in heart disease. Because we're learning more about, like, we call it, like, cardiometabolic disease. And it's that, like, a lot of this, like, sedentary lifestyle, obesity, sleep apnea, sleep disorders, they're all related to heart disease. And that people who have weaker skeletal muscles, they do worse. And in all the heart failure trials and all the heart failure things, they talk about people with really weak skeletal muscle, they just have worse outcomes. So I tell all my old ladies that if you don't have good, like, abs and your core and your hip flexors, like, you're just going to do worse, right? Because you have to have that skeletal muscle. And there's all the science about your skeletal muscle. I feel like people forget that, like, actually being fit, meaning not just running, but, like, weightlifting is really, really helpful for your heart. Not, like, necessarily bodybuilding or something.
But you just move your muscles.
Your muscles. People think that, like, I walk. So I walk a lot and I'm okay.
Right.
So I have all these old people say, like, oh, I walk 40 minutes every day.
But you're not strengthening muscle.
I'm like, wait a minute. Like, you're flabby here. You don't have any pec muscles. Your legs are skinny. Like, what about your, like, muscle or skeletal muscles?
Yeah.
To maintain your frame. Like, what about that?
So
that's important. And
okay, I've got two questions for you. One is going to be a very simple yes or no. Is it true that sitting down too long, or, you know, like you said, just not having an active lifestyle can kill you as quickly as smoking cigarettes?
Yeah, I mean, I think, like, definitely being sedentary is really bad for your heart in terms of outcomes. Whether there's a correlation between...
It's a study I read somewhere, but I just wanted to know if, like, it's backed by science.
Like, I mean, the short, non-specific answer is yes.
Right.
Because we know that people who walked 7,000 steps and more, and they follow these people for, like, 20 years, the people who are walking 7,000 steps a day or more, they had less heart attacks and strokes and heart problems at the end of it all. Right. And so we do know that your step count, which is something easily monitored on your phone, anyone can do it, tells a lot. And so, yeah, like, if you're the opposite, you're sedentary, you are going to have more chances of it happening. You're going to have more chances of heart disease and all these things.
Right.
And it probably puts you in the same category as people who are just smoking all day.
Right.
Whether it's, like, exactly like that.
Well, it could be very close, or it's just as bad.
It could be, it's association.
Second question is, I want to go back to the topic of genetics. Again, you know, I read things, but I'm not a doctor myself, so I can't verify the research. The highest, something with African American females specifically, are more prone, is it, to heart attacks? Or something related to a heart issue?
So, I mean, I think there's a lot of studies that, like, African American females are oftentimes the most, like, overlooked population in hospitals. Their symptoms get ignored. They don't get treated the same. Their pregnancies are more complicated. And oftentimes they will be having heart problems, but they'll be, like, underdiagnosed or misdiagnosed or like that. And unfortunately, there's, like, racial bias that still exists in medicine. A lot of the trials don't always include African American females. They're male-dominated trials oftentimes, and so there's some, like, racial bias in the data. And then there's, like, nitty-gritty, like, grassroots racial bias for a lot of people. These people are dismissed. Their symptoms are dismissed. And women, their heart symptoms are always atypical. They don't always have the crushing chest pain, like, classic. they'll come with different types of symptoms. So unfortunately, I think a lot of the studies show that that is the case, that women in general are underdiagnosed. They have different symptoms, and they have higher complication rates too.
That's why I always tell people, never rely on statistics when it says 1 out of 8 or 5 out of 10 people. Those people didn't necessarily include you, right?
Correct.
So from a media point of view, when we used to do media studies, majority of the research conducted would only ask white folks. It wouldn't care about Arab. So there could be 10 Arab over here and 1 white guy. I would ask him. Now, I'm not saying necessarily it's a racial thing, even though you can make the argument, and a strong one, but it was more inclined on a financial. Who's more likely going to buy the product? This guy is an immigrant. He's got to worry about his kids. He's got family responsibilities, yada, yada, yada. Whereas Joe over here, generational wealth, etc., etc. But you're saying now that happens in medicine too, that when you're doing your, medical studies and research, you're also looking at a specific group,
Correct.
Not everybody
For
involved.
sure. I mean, we don't really know about as much about Southeast Asians, for example, like Indo-Pakistani people, Asians. They have higher cardiovascular risk.
Correct.
And actually now we're learning that when you calculate someone's cardiovascular risk, you look at diabetes and hypertension, all these things. But if you're Southeast Asian, you have a higher risk just by you being Southeast Asian. So I'll look at two patients, both 50 years old, both diabetics, both have high cholesterol, and they smoke a little bit, and they both work in construction, and they both are a little overweight. One guy's Southeast Asian, one guy's Caucasian. By being Southeast Asian, that person has a higher risk, even though he's the same otherwise.
Is it food or lifestyle?
It's probably a combination of food, lifestyle, and genetics.
Okay.
And it's because we don't know about that population because we haven't studied that population as much.
Do you think how much of it is stress related, right? Because there's a lot of things and I'm not saying white folks are bad or anything. I'm just saying it's different values, right? For us, your parents will get angry if you do something, or if someone just said something about the family, or if you did something that could bring us down, or your studies are bad. I don't know. I'm not saying it's bad parenting on the other side, but do you think that lifestyle, that culture can increase the reasons for, having a heart attack at such an early age because you're stressed all the time? Because even Arab, we say, after the qalbi, you're gonna give me a heart attack. You know what I mean? Or
Well, I think I think what you're asking is basically do psychosocial stressors that differ in different groups have different impacts? Obviously, yes. If you're a girl in the Arab community, God forbid you get a divorce, that's the end of your life, right? And that stress is different than somebody else who's not Arab who gets a divorce, and that has an impact on your life. I mean, how many people will get depressed and they'll start having pain and palpitations and all these things in their hearts, and they feel bad. So absolutely, that your psychosocial stress does impact your cardiovascular health, 100%.
I mean, stress is gonna
impact no matter what.
Everything.
Yeah.
But you got different things. That's what I'm saying.
But
you can.
Yeah, but Teef, you've asked me a lot of questions.
Okay.
But I have one question I want to ask you because I think your journey is probably the most interesting of all the people you interview.
I appreciate you. You the same thing.
Because you grew up in Iraq, you came here, and I remember seeing you at the barbershop on Warren when I first met you, when nobody else knew you. And I always tell all my friends, I knew Teef before anybody did, before anyone.
Yes.
And you were just working your butt off. You were being apprenticed to someone who was older than you and respectful. But you, from that point till now, how did you deal with failure? Because I know that you're full of success and you're successful, but you've had to have some failures. You had to have these lows. How did you deal with just these failures where things didn't work out? How did you get through that to get to where you are now?
It's an amazing question. By the way, before I answer it, Adam,
Day one.
I met him when I first came to America.
Yeah.
When did you guys meet?
Salan Abdullah.
Okay.
I always give him big shout out. One of the amazing people I worked with.
Yeah.
I always, when I cut his hair, usually they cut with Mac and no one cut with me. And then when Mac traveled to Germany, I started cut them. Even on the chair, I'm cutting his hair. his laptop, he was study before he got a doctor. Man, what does this guy do? Like, I want to cut his hair and he keeps study on the... That's how, like, he was into doctor school. So I'm gonna...
So continue, what happened then? I want to know. You had a conversation, obviously. What was it like?
Me and him?
Yeah, like you saw him on his computer. Did you ask him or no?
Yeah, he was steady.
Yeah.
And look at him now.
Yeah. Well, it's crazy, like...
Because we see each other.
Because I'm trying to remind him of a conversation. You've told me this story before. I just didn't know this was the person.
Well, the crazy thing, back then, Teef, he didn't even speak much English.
Yes.
And so it was literally like...
Still doesn't speak much English.
I was a medical student, and I just remember, like, no one knew him. He's just a guy, and I would just go cut with him, and he was pretty good. I could tell with his hands. I could tell, like, his, like, you know, finesse.
Right.
And I was like, man, this guy's pretty good with his hands.
I appreciate you.
And I remember that from that time. And there's one story that I have to say that you have to do is that there was one day I went to that salon, and Teef was busy with somebody else. And there was another new guy. And the other guy started cutting me. And the whole time he was cutting me, he was doing a bad job. But Teef was watching the whole time. And I could tell by his face,
he's not happy.
He wasn't happy. So after he finished, Teef pulled me aside. And he said something like, "You'll come back," because he didn't do what you need to do.
Yeah.
And he brought me back and he cut me properly later on.
Did you understand his English though?
So, now even he knows, even like any barber around me, like I want them to be top notch.
Yeah.
Like when they do little mistake, hey, I call them on the side, just make sure.
Yeah.
Do this.
Yeah.
I've seen it plenty of times where...
That's the way to do it, man.
Yes.
Yeah.
You can't let anybody like, oh, you know what? He doesn't know about haircut. Let him go. No.
Yeah, no, it's like,
you gotta do it from the heart.
It's integrity. Right?
Yes.
It's like someone did a bad job around you.
Yeah.
It's like you're like, man, like I don't feel right. Like, hey, man, like just come back.
And I'm not.
I'm gonna go back to your question.
Yeah.
So, alhamdulillah, I always put things in my head.
Yeah.
I gotta do.
Yeah.
With God,
Yeah.
like, I gotta make it happen. I don't know how long gonna take me.
Yeah.
I'm gonna keep going hard until I get this done. But if I fail, it's okay. We all fail. But I'm not gonna be upset. I just learn from it.
Yeah.
So that's what keep pushing me go harder until alhamdulillah.
Dang, man.
You know what's the beautiful thing about failing?
Yeah.
Allah subhanahu wa ta'ala says in the Quran, Bismillah ar-Rahman ar-Rahim, indeed Allah can turn all your sins into good deeds. What does that mean? How does He do it? When your failure becomes a lesson, it's no longer written in your book of deeds as mistakes and sins. It was written trial and error to make you who you are today. So
beautiful.
You should fail in life.
Yes.
If you haven't failed in life, you failed in life. You understand? Like, you should fail and learn from your failures. And we talk about this sometimes, like behind the scenes, you know, look up for so-and-so, everyone's like dumping on them right now, you know. We'll both say this, yeah, but it's okay. This is their low point that they need to know. I gotta like fire up and move forward.
Other question. What's something you learned from a patient and got stuck with you? Like something you learned.
That school didn't teach you.
Wow. That's a tough question because, like, you know, we learn from our patients all the time.
Indeed.
Because patients present differently.
Mm-hmm.
I think, I think that's a really good question. I have to think about some lessons there.
We're gonna come back to this one. Yeah. Give him a second.
Think of like a good like patient lesson that someone taught me, because they learn a lot. But let me ask you one question, Teef.
Done.
That you know, like it sounds like when you were on your journey to get to where you're at, you know, whenever you had failure, you said you learned from your mistake, you accepted it, and you just went on. But how did you deal with like the emotional stress? You know what I mean? Because like, you know, you don't have much family here, right?
Yes.
Like who do you go back to? Like, for example, like if you go home and you're like, man, like I didn't do that good, I didn't get much clients, and I'm just struggling. How do you, like, who do you turn to for like advice or help, or like at that time, like at that vulnerable
Yeah, because I don't have people.
Yeah.
So that's amazing. I always like when things like it didn't turn out good,
Yeah.
I do a lot of research.
Wow.
How can I fix this like in the right way?
Nice.
Do research. How I get people, back then, like when I first started, it was hard to let people know about me. So what I do from social media, tag that person, Adam, come to me. Hey Adam, I'm gonna tag you on my story. Adam repost it, and top of it, you have fun. They're gonna see you. Oh, who cut your hair?
Wow.
So that's the stuff I learned from.
That's awesome.
It's amazing, like amazing feeling. So back to Hussein, the question. Can stress get heart attack?
Yeah, so basically there's something called stress-induced cardiomyopathy. It's known in the media as like broken heart syndrome. Maybe you've heard of it, where the classic is like a lady who her son dies and she's in so much stress that she has a heart attack. But it mimics like a true heart attack where the blood vessel blocks, like I told you, but when we go inside her heart, there's no blockage. It's purely the stress that the stress that the person is facing, that itself causes a heart attack. The heart markers will go up, the heart will be damaged, they might even, heart might stop even. That's called the stress-induced cardiomyopathy, and there's a characteristic image that was described by the Japanese called Takotsubo cardiomyopathy, and it's when you take a picture of the heart muscle, the top of the heart contracts, but the bottom is blown open. It's like it's just blown open, looks like an octopus jar. In Japan, they use these octopus jars called Takotsubo. And so I saw this just the other day, and it's very common in women or people with high anxiety that they get so stressed out that they literally, clinically, when you see them, it's a heart attack. But when you go in, they don't need a stent. They might need medications, but the stress causes their heart to become stunned. It just stops. It just blows open and it just stops, and it doesn't conduct.
When it blows open, it's empty, correct?
Yeah, by blown open, that means it gets dilated. It stretches open and it doesn't contract. Your heart's supposed to squeeze.
You know what's the most beautiful thing about what you're just saying? I really wanted to ask you this question, and you just answered it.
Yeah.
Allah subhanahu wa ta'ala describes, it's how subhanallah, he said mothers and their children.
Yeah.
When Musa was separated from his mother, Allah subhanahu wa ta'ala says, فَأَصْبَحَ فُؤَادِ أُمِّ مُوسَى فَرِقًا. Okay. Fu'ad, he didn't say qalb, he said fu'ad. Fu'ad specifically in the Arabic word, it used to be used when a forest fire or something happens, and it's the darkness that is remained from the soot. Okay? So her heart she was burning for her child, right? But the next word, fariqa, imploded. It's imploded, it's burst, khalas, everything is gone, right? لولا أن ربطنا على قلبها. Had we not tied something on her heart to constrain it, she would have died.
Ajib, subhanallah.
Just because her son was removed from her.
That's insane. I never thought of that. Because this is something that is so well reported now, and we don't know why it happens, but the heart just dilates. It just becomes like a bag, like a sack. The heart's supposed to be like muscle. It's tight. It squeezes. It contracts. There's a pump. But when you're stressed out, it causes so much surging that the heart muscle becomes stunned, and it just becomes like a bag.
No, it's like a football that gets cut and then the balloon just pops, right? It can't contain it. Khalas, it can't contain itself. Yeah.
I know, Adam, it's late. Before we end the podcast, I was wondering what your day looked like when you first get into the hospital.
Awesome. Yeah. So my days I think more intense than you would imagine. So typically we're interventional cardiologists, so everybody has our number because people have to call us urgently. So right around 6 a.m., all the nurses who are working at the night, they're going to leave at 7. So they start messaging us. And nowadays they have all these apps for the hospital. So they'll message us, oh, overnight this patient had this heart rhythm. Overnight this patient's heart rate was low. Overnight this patient's blood pressure. This patient's complaining of chest pain. So even though I'm sleeping, I'll just start getting messages. That's my wake-up alarm. And so right away, I suddenly get told by patients. So I get up, I pray, I wash up, I get my kids up, and then by like 7 o'clock, 7:30, I try to leave to go to work. And typically I'll go to one of the hospitals, and the first thing we'll do is we'll start doing procedures. These are heart catheterizations, which is when we go into the heart, we inject contrast, we look for blockages. So we start doing that, and I usually have anywhere between 2 to 3 procedures. You don't want to do too many because it's very exhausting for your body. You have to wear lead because there's radiation. So I get affected by radiation all day. So I have to wear lead all day. So it's heavy. The lead is like, the 20 pounds of lead on your back. Wow. So you have to wear that. You have to stand up, do the procedure. So you try to do a couple procedures, and in between procedures, I go around and I see patients in the hospital. I answer calls. I have to read imaging of the heart, so read echocardiograms, nuclear studies, EKGs, and we're reading the studies, we're doing the procedures.
So the guy who's telling people to not live a stressful life and save their heart is living the most stressful life.
Yes.
Yeah.
That's where to go, baby. That's what I'm thinking. I would have quit by 11 a.m. I would have said, this was nice, Mom and Baba. You said, be a doctor. I became a doctor. Now I'm going to go work at McDonald's.
That's a good point. It's a good point.
It's very stressful, bro. But
I think it's not like it's stressful because sometimes it's critical, right? Like while I'm saying all this, someone could have a heart attack at 11:30, and I wasn't prepared for it. So my day is completely changes because someone's having a heart attack. So I got to do that procedure. They take preference. So you just everything changes in a split. Yeah. So you prioritize. But the thing is, like, we look at like minutes. Like some people are like, what am I going to do in the morning? I'm like, what am I going to do from 9 to 9:20? Can I do a procedure, see a patient, call somebody, and be done in 15 minutes? So we're all about like optimizing like 5 to 10, 15 minutes is really important. When I'm doing a procedure, I'm like, okay, I have to be in clinic in a half an hour. I'm doing the stent. Can I do the imaging, and can I put the stent in within 15, 20 minutes? So we're like obsessive about minutes. And when we go, we're like, I have to do something. I have to go read an echocardiogram. I have to go talk to a patient. You're always doing something. So it's good because you maximize your time. So I do in a day what people don't do in a month. Just because like I'm maximizing minutes. Yeah, minutes. And that's the cool thing about our field is that it forces you to do that because you're just so busy with stuff. And then it can get stressful, but like my personality is I kind of like just relax and enjoy the flow, and I find like I enjoy it. So it doesn't stress me as much as you would think it would.
I'm a strong subscriber of the idea there's order in chaos.
Yeah.
And it looks like that's what you've got going on. It's chaotic, but it's order.
It's order, and you figure it out, and you prioritize it, and you just have fun with it.
Thank you so much for coming.
Well,
I really appreciate you. And please, I need you on that, like, if you guys can, you on your team.
Yeah.
We do one, that would be amazing, helping a lot of people about this knowledge.
Yeah, no.
If you're gonna make it happen, that would be amazing.
No, we should do like a group thing. We should bring like some of the people.
I have one question for you before we go. You said you see your patients improve over time, right? How much has he improved in his English over time since you met him on day one?
I mean,
because for me, there's no improvement.
He was shocked.
Yeah, I mean, no, 100%. I think like Teef has become so cultured.
Like he is muthataf.
Like he's so cultured. Like he's kind of like picked up all these social cues, and he's good. Like you're talented. Like sometimes I'd see you would know like different verses of like a rap song, but like that's like poetic. And you would do the rap song. I'm like, man, that's pretty amazing because it's not your language, right?
Yes.
But you know it so that you can appreciate like the nuance of the rap song.
100%.
Right? Like the way the rapper does it. So I was like, man, like Teef has gotten pretty good. So I think it's like good. I think if you just like formalize your learning, you start reading some books or something, you're just gonna fly.
I appreciate you. He said, man, you just shocked me. Like, I remember you can't even talk now. You have podcasts.
Yeah. And subhanAllah, yeah, look.
And all from God.
All from God and all from confidence also.
Oh yeah,
you understand?
100%.
You got
I've never been shy like how I talk. I just say it how I say it.
Be you, khalas. Yeah.
Confident person, and you're comfortable with who you are.
Yes.
You know, you're Muslim, you're Iraqi, you're living in America. This is your craft, this is your skill, and you're gonna do it the best you can, and you're gonna keep, like you said, you're hungry to do it better and do it more. You want to leave a legacy.
Yes.
You want to
He
be
literally
like,
lives by the world will get what I give it. That
Yeah.
philosophy, like
Yeah.
that's, and more people need to do
It's
that
good.
sometimes.
And the
I
crazy
swear.
thing, again, like the mind-boggling thing for me is that you're doing all this essentially being alone. Like you don't have like your whole main family's in Iraq. You're living by yourself. Your parents are away, and you came here when you were young. You could have gotten into like drugs. You could have gotten into like alcohol. You could have gotten into the wrong crowd, and there's no one to hold you in. But instead, you just started showing up at Abdullah's shop in the morning, working hard. It's just amazing that like somehow like you were protected from those things just enough for you to be cool, be funny, be cultured, sports and all that, and then make it this far. I mean, Allah, like,
I appreciate you. God bless you, my brother. Thank you.
Mum's dua.
Thank you so much.
It is, man. Mum's dua, wallah al-azim.
I
Mom.
really
prayed for
my
you
mom.
because- yeah.
My
Mum's
mom.
dua.
She must have,
Allah
because
yarhamha.
like,
Yes.
how did you get there? Because I bet you for every one teeth, there's probably 15 other Iraqi guys that came at the same time. Some of them could be in jail. Some of them could be like give up their religion. Yep. Some of them could be lost druggies or whatever. But there's one teeth that made it.
I appreciate
You know what I mean?
I appreciate
You know
it,
that's
bro.
true, right?
Alhamdulillah.
How
Very
many
appreciate
people we know from
You know
Iraq?
my first experience in Dearborn, I came here, Muhammad Mawla, have to give him a shout. He actually introduced me to Dearborn properly. But when I first came to Dearborn, one thing that really, really hurt me was I was on Beach Daily and Warren, I want to say, with that BP gas station at the very end.
Yeah.
And I just pulled up into the gas station, and you're used to going to a gas station in America and like I don't want to say the word bomb, but that's what people call them, right?
Yeah.
So you're used to seeing like a crackhead or
Yeah.
like he's white, he's like a I don't know, trailer trash, whatever you want to call it, right? Because again, just coming from Florida and New York and all these places, and I see him walking towards me, and I'm like, here comes this cat, like astaghfirullah, like I'm not anything, but I'm like, I don't want to deal with you right now. It's nighttime, I don't know the ends.
Yeah.
I'm not from these parts. I just want to like not talk to you. So as I'm walking away, he said something that only like Iraqi from the village would say, He goes, like, I shouldn't say just Iraqi, but like, Ashair people.
Yeah.
He said, Dakhil ala Allah thumma alaik. I swear that rocked me to my core. So we, as Bedouin people, as tribal people, when we see someone and we know, like, yo, I'm at a very, very low point. Mm-hmm. But after God, you're the only other guy I'm gonna ask. Right? Now I know for cats, they'll say anything. Yeah. But the fact that he said something like, and I was like, yo, that's my people.
Yeah.
That's like one of my own. Like,
that's crazy.
You know what I mean? So I turn around, I'm like, Tem, like, khalas, like, I know you're gonna take the money, go drugs, but I can't say no to you now.
Yeah.
Which literally translates, I've knocked at God's door, and now I'm knocking at your door because God told me to come to you. So you're right, man. Like, I swear to God, as long as I've known Teef, we crack up, we talk about everything. He really could have gone off track, really easily.
When your family raised you good, you will never do these things, bro.
But Mum's dua, man, alhamdulillah.
Thank you for coming.
Amazing.
I really
amazing,
appreciate
amazing.
No, thank you. This is great, man.
I respect you this much more.
It's like, it was awesome meeting you, man.
If you want any question about heart, drop it down.
Yeah.
We're gonna discuss it with Dr. Adam.
Yeah.
We're gonna make it happen.
The love doctor.
Peace out.
Yeah.
Peace out.